Okay, it's all yours.
Okay, good morning, everybody. I'm pleased to be here. My name is Robin Adams. I'm Vice President of Business Development at VHC Health. I've been here since last July, and I came at an exciting time where, as was told, the outpatient pavilion rose from the ashes and really has become a fortress of great healthcare on the Arlington campus and actually in the broader Northern Virginia market. Next slide, please. I'm going to talk a little bit about the outpatient pavilion. Kathy, I just want to clarify, are you driving?
Kathy, you're
Hang on a
muted.
second. We're having some technical difficulties. We'll get it.
Okay. I'll just continue as she's working through that. The outpatient pavilion, as many of you know, opened last July, and it really is a state-of-the-art ambulatory center. What I mean by ambulatory is it's not really meant for acute care. What we did is we moved a lot of the elective outpatient specialty services from the hospital into this building, really because we wanted to create a more calming, natural, elective environment in which people really seek health, right? They want to maintain their healthiness, they want to get their screenings. So what we did is we pulled a lot of the medical specialties out of the hospital and into this setting. It really is considered a one-stop shop, a single location for many common healthcare needs. And as I said, it really separates that elective outpatient care from that emergent acute inpatient care milieu. Efficiency is really a key priority. We want to make sure our patients are well cared for. They get in, they get out, and their appointment starts on time and ends on time. And for those who've not been there, it really is a beautiful building filled with natural light, and it's a modern aesthetic. And I think all of us know that, barring heat waves, natural light, nature is very calming and very good for one's health and wellness. We've also taken some liberties to really introduce state-of-the-art technology, which I'll go into as we get into some of the specifics of each floor. Next slide, please.
Oh, there we go.
Just to navigate you to the hospital. So most of you know the hospital, the Zone A, which is, as we affectionately call it, the 1625 building, the 1635 building, which is Zone B. We've got the Zone C. All of this really constitutes the acute care facility. And then Zone D really is part of that as well. That's the 1615 building that many of you know. So the purple is the outpatient pavilion. It is on our medical campus. It is adjacent to the hospital. And what's really nice about it, and I'm sure you all saw the excavation of land, we've got parking underneath that building, lots of space. And so all one needs to do is actually park underneath the building, go into the elevator bank, and you're literally within the building. That's what we call Zone E, or the other purple zone. Again, it's just the parking is steps away, and it really is meant to really facilitate access for those who are able to walk in and those who may have difficulty ambulating. Next slide, please. So this is my attempt at just an overview of the rendering. We call this a stack graph, if you will. And I'm just going to start at the bottom. We affectionately call it the garden level. That's where we have the outpatient rehab. And I'll go into each one of these in more detail in the following slides. So the outpatient rehab is on that garden level. The lobby level includes our what we call ancillary services. I'll just highlight that might be the lab, the pharmacy, the women's imaging center. If you need MRI or CT, any X-rays or ultrasound would be part of the lobby level within the ancillary services. The second floor has our endoscopy suite and outpatient surgery. So really knowing that those are invasive or areas where invasive procedures are done, there's opportunities to share staff, anesthesia, many of the support services, if you will, behind endoscopy and the outpatient surgery. On the third floor, we have many of our medical specialty practices, including GI, for example, primary care. Again, we'll go into more detail there. On the fourth floor, we bring all of our surgical specialists together. So we've got urology, we've got general surgery, bariatrics, we've got a hepatobiliary surgeon. So again, they are all convened locally. And I'll go into the rationale behind this convening of specialists on the floors, which is evidence-based. On the fifth floor, many of you may know, we opened our Women's Health Center. I'll go into that. It's a very exciting contemporary practice where we really pull all of our women's subspecialists together. And it really, again, is indicative of the great collaboration and really the discussions they have around shared patients. And then on the sixth floor, that really is what we call shell space, and that really is to address future growth. And we've got a lot of folks vying for that space, but we really want to make sure it's founded, whatever we put there is founded in what the community needs, and it makes most sense. So what to expect when you come to the Pavilion. It's really meant to be easy access, it's meant to be convenient, and it's meant to save you time. We know that you're consumers and you have great experiences, whether in banking, on Amazon. And so again, we talked a little bit about the parking. You arrive on campus, it's really meant to be convenient. You literally get into the purple bank of elevators and you go up to that first floor, the garden floor, whatever floor you're going to. You then check in. You can see that we have a kiosk here and, on the lower right side of the slide. And that's really meant to give you agency as a consumer. Make sure that your information is right, your name is spelled correctly, the right address, the right zip code, the right phone number, the right health plan. We feel that giving patients or consumers agency when they're having a healthcare experience is a way of giving them some control. And we know that that lends itself to a better experience for the consumer. So you would check yourself in. There are ambassadors there to help if you've got issues. And again, it's really meant to give you the agency. You'll be welcomed. Then the care team, what's interesting is when you check in and register yourself, it alerts the clinical team that you've arrived. And so again, it's really meant to be a seamless experience for you. There's open seating. A medical assistant will get that notification that you've arrived. They'll greet you and then they'll escort you back to your appointment location. And really, this is meant to really demonstrate our commitment to advanced digital technology. Most of our experiences as consumers have been digitized, whether again, it's banking, Amazon, retail, and we want to make sure that you've got that similar experience here. So the other thing that we are really proud of is the facial recognition. So you are who you really say you are. So I don't know if anybody ever goes to the airport, there's Clear where your eyes are scanned, your face is scanned, whatever you choose. And it really validates that you are who you say you are. We have that same technology here through this facial recognition. There's a scanner to copy your driver's license and just some other information. So again, just a little bit about the practice layout for your appointments. You can see in the top picture here, very clean aesthetic, We want it to be a calming experience for you. You don't need the hubbub of, what's happening, behind the curtain, if you will, and, the work team working and the phone calls that are happening. That's really meant to be outside of the patient experience. So it's a concierge-like environment. Again, goal of reducing patient anxiety. When you present, everything is brought to you in the privacy of an exam room. So your vaccination, if you have to have blood taken for labs, any EKGs, again, brought to you and we call a concierge-like experience for you. After your visit, the medical assistant will schedule any follow-up that you may need if you're ready to make those appointments. So again, it's really meant to be surrounded by your needs. I don't know if all of you have heard of Virginia Mason. They are based out of Seattle, Washington, and they are one of the best practice sites of care in the nation. When we designed the pavilion, we actually we went out to Virginia Mason and really looked at how they practice medicine to say, how do we continue to get better? That's one thing I love about VHC Health is this willingness to look in the mirror and to continue to improve services, clinical services, and how we provide services. So as you'll see, an open floor physical design, very much support collaborative space for practice team and providers. Evidence suggests that when you've got collaboration and teamwork, there's better outcomes for the patient. We've got status boards, so we know, for example, if somebody's having surgery, we know that they've registered. We know that they're in the waiting room or the lobby. We know that they've been brought back. We know where they are in their care delivery. And that's really important to us because we also want to make sure that the family, the significant other knows where that patient is in their care experience. Private space, as you can see here, so you don't have to walk through practice operations. And then we've got dedicated provider offices to host video visits and prepare debrief visits. So again, along this back wall, you can see this light. That entire wall is physician offices and some of our directors' offices and managers' offices. Again, to keep that operation out of the physician, or pardon me, the care delivery. Next slide, please. So we're going to go to
Robin, we've got a couple of kind of general questions here.
Of course, please.
Somebody had asked about parking, and you said you would address that. So
that's me. I'll address that. I'm going to talk about when I get to my part. Gary, I'll talk about our senior associates program, and if people are coming to the hospital a lot, it's a great deal that will help them with parking. So, but it is $7 to park at any of our garages. But yeah, later on, I'll talk about our senior associates program and a way to alleviate that cost if you're coming to the hospital a lot.
Okay. Robin, you've mentioned a couple of times about various surgical practices that are set up in the pavilion. Are there hospital rooms in there, or is it outpatient only?
It's outpatient only. So again, we were very deliberate in keeping acute care in the rooms in the hospital. And then this is ambulatory or outpatient only. Again, we have ORs there, we have procedure rooms, but instead of doing those kind of services in the main hospital, if a patient qualifies and they're healthy enough, we will have that surgery, for example, done in like a GYN surgery or maybe a hernia repair for a healthy patient would be done in the pavilion in their what we call the ambulatory surgery center.
Okay. Have any of the medical practices from it that have been in the 1635 building, have any of them moved into the pavilion?
Yes. What we did is in any of the medical office buildings where there are VHC Health practice, we moved our physicians into the pavilion. So if you see a physician group, physician, let's say one of our urologists, for example, they did move onto the 4th floor of the pavilion.
I just want to say, so most of the physician groups that moved from the 1625, so the big tower. And the reason for that is on the 3rd and 4th floor where we had those physician offices, they moved to the pavilion, and we're actually adding, we're under construction now, and we're adding patient rooms to those floors where we used to have physician offices. So that's where most of it's those physician offices that primarily moved over to the pavilion.
And that,
Okay,
as Kathy said, that offered the space to be able to then expand the beds within the hospital.
Okay, the next question is, once a person checks in, if they know where they're going, do they have to wait for an escort for one of the ambassadors, or can you just go up to wherever it is you're going?
You can, what you could do is you go to the floor that your doctor is on, and then you will go to the kiosk, you will register, and then somebody will come and get you. You can then sit back down, or you can wait, and then somebody will recognize that you have registered, that you're in the lobby, and when I say lobby, of whatever floor you're on, waiting area, and they will come and get you. So you will not be able to go back as a patient. Somebody will escort you back.
Okay, I'm a little confused. Do you register in the lobby when you first arrive and then go up to the appropriate floor and register again, or what?
That you register on the floor that you are going to be seeking care.
Okay.
My
Thank you.
apologies.
That's okay. And then the last question here is, are there primary care physicians located there? You know, is it going to be a one-stop shop where they can get blood work and, you know, other labs done?
There is lab on the 1st floor, and some of our primary care doctors are there, but not all of them. So if you see Dr. Walsh, for example, Dr. Walsh is at our Shirlington primary care, but we do have a primary care practice, but it's only one practice. So if that is your doctor in your doctor's office, that's where you would present. So in that case, yes, it would be truly one-stop shop. But because the way healthcare works, we need primary care out in the community close to where people live and work. And so we have a distributed, we oversee Northern Virginia with primary care. So whether it's McLean, Shirlington, Alexandria, and we're looking West Springfield, we've got West Springfield, Tyson's. So we've got primary care in all of those various locations, and specialists who then also round in those outpatient practices. But this is really meant to be a one-stop shop for specialty care as much as possible.
Okay, so if somebody does need blood work or other lab work, that would be done at the same time as they had their appointment. It's
Yes.
not come back the next day.
Correct.
Okay.
Any
Last
other-
question is, will there be places to park e-bikes?
I believe there are places to park bikes. I don't know if we have places to lock up within the garage. I would need to get that.
There is a parking, there is in the deck, there is a parking, a bike parking thing, but I'm not sure if it's just for employees or if it's for everyone, but I will look, I'll ask. Rich would know. I'll ask and I can get back to you.
Yeah. Great question.
Well, I think that's it for now.
Okay. All right, so I'm going to go into a little bit more detail on that stacked slide that I just presented. So we talked about the garden level, and that is outpatient rehab, and we're really proud of our outpatient rehab. We have a full cadre of subspecialist physical therapists, whether it's general physical therapy, occupational, speech language pathology. We've got folks who are certified in balance, lymphedema, those who only do hand therapy for injuries, and orthospine. We've got a pool for one-on-one aquatic therapy. We've got a pelvic floor therapy. And really, I've worked at a lot of places. This is one of the most comprehensive outpatient rehab sites I have ever seen in a hospital setting. And so kudos to VHC Health for bringing all of this excellence and all of this excellence certified PTs, physical therapists, to the center. Again, we've got state-of-the-art equipment, and really thoughtful planning went into the design of the gym, the treatment areas, and I always like to give some examples. So for folks with lymphedema, the area where they would be treated is right in the front for easier access for folks with limited mobility. The pelvic health therapy happens in private rooms with bathrooms because of the nature of the physical therapy. And as we've talked about a little bit before, it doesn't feel clinical. Lots of natural light as appropriate, lots of windows, lots of wood paneling to really just ease patient anxiety. Lobby level is what we call our ancillary services. That includes our advanced imaging. And again, with this new building, we brought in state-of-the-art technology like the Mammomat Revelation. It really is making imaging more comfortable, more accurate for mammography. We've got 2 MRIs, we've got CTs, we've got ultrasound, nuke med, PET diagnostic X-ray, and fluoroscopy. So again, a full cadre. You can see, again, thoughtful planning where there are beautiful tiles looking at nature as you're, in the CT, just to keep yourself distracted. And then this new Mammomat Revelation causes less pain for women who are having their annual mammogram. Other services, outpatient lab, it's open from 7 to 6, Monday through Friday. So it offers, easy online scheduling if that's what you're seeking, but it's not required. The lab services are available to anyone with a lab order. And so it's not just VHC Health patients. So if somebody needed to get a lab order, they can come in even if they were referred by another practitioner in the community. Many years of experience in patient care and phlebotomy, and they really do quickly turn lab results around for same-day turnaround. And for real specialty labs, we do have a relationship with the Mayo Clinic, and we send those niche tests really to their reference lab. And then lastly, pharmacy is open Monday through Friday, 9 to 5. It's open to the patients and the community, just like the outpatient lab. And like lab, it's really meant to make it easy for patients and their caregivers to fill prescriptions, as they're leaving the hospital, enabling them to start the medications without delays. We also offer vaccines, and then there's durable medical equipment and over-the-counter drugs as appropriate. Second floor now, this is what the endoscopy and the outpatient surgery center. It is accredited. And again, we love accreditation. We like to open up our books and our operations to external validators to demonstrate not only to ourselves, but to our community that we provide excellent care and quality care. And so we were recognized by the VHC's the Endoscopy Center earned a national accreditation by the American Society of Gastrointestinal endoscopy, ASGE. And it's the gold standard and attests to the excellent level of safe and quality care. We perform about 8,000 endoscopic procedures annually. And these include the upper endoscopy, colonoscopies, and biliary procedures. We have very low complication rates. Again, we're only one of 600 units recognized by the ASGE in the country. So yeah, we're very proud of that. And then for our outpatient surgery, we've got a number of accreditations. We are MSQIP accredited. That is for bariatric surgery. Our surgeons are fellowship trained, nursing support. We've got nutritionists. We've got registrars. And as part of the MSQIP, we actually evaluate our data, and our data must be put into a registry. And we are evaluated against other MSQIP accredited centers across the country. And really, we are confident in what we're doing, and we like to compare ourselves and demonstrate that we're top tier, both locally as well as nationally. And then again, we do have a relationship with the Surgical Quality Center, which again is another great attestation of our excellence. I'm just looking at some questions on the same day. Okay, my wife and I just moved to Arlington, Virginia Square, about 10 minutes away. How do we get established with it's getting cut off here, with a gerontology? Again, more than happy. I see Bobby A. More than happy to give you a couple of names of physicians who are on our medical staff who are board certified in gerontology. What types of insurance are accepted? Medicare, private insurances. We really accept all of the major insurances: Blue Cross, Blue Shield, Care First, Cigna, Aetna, TRICARE for former military, Medicare, and Medicare Advantage. Okay, so third floor is our multi-specialty practices. And we've got gastroenterology. We've got, as I mentioned, advanced endoscopy. We've got 2 GI specialists, women GI doctors who really love women's health and GI. So for consumers who are really interested in seeing a female GI, we've got those 2, but they also really fold in and work with our OB doctors very closely, especially when women may have issues related to pregnancies. They do colonoscopies, as we talked about. They do the whole gamut of upper endoscopies to colonoscopies. And they do really the screenings, the preventive care, as well as chronic care. Heart and vascular is also on the 3rd floor. And we've got medical and interventional cardiology. We have what we affectionately call the heart station, which has all of our cardiac testing. So from stress tests to cardiac monitoring. And so that's what the heart station up on the 3rd floor. Our cardiac, vascular, and thoracic surgeons are up there as well. So Dr. Ree and Dr. Garrett are up there, and they see patients up there as well. The bariatric and metabolic healthcare team is there. And we've got pregnancy-related heart and vascular care as part of our heart and vascular care. So that's our team on the heart team, on the lower right in that photo. And our GI team, the gastroenterology team, is on the upper right in that photo. And as I mentioned, we have primary care on the 3rd floor, just a couple of our practices: family medicine, post-hospital care, and then we do have some women's health primary care physicians up on that 3rd floor. In terms of surgical specialty practices, this is the 4th floor. We've got board certified and fellowship trained surgeons and medical specialists. And again, part of the reason of aggregating and cohorting the surgical specialists is it really does create that multidisciplinary care team, which has been demonstrated and evidence-based to improve outcomes for patients. And so, again, you can see the Bariatric and Metabolic Health Center, got the obesity medicine, nutrition. We've got psychology part of that team, nursing coordination, general surgery. We talked a little bit about that. That's the gastrointestinal and foregut surgery, bariatrics, surgical onc, and minimally invasive robotic surgery. We've got a tremendous urology, colorectal, and hepatobiliary and pancreatic surgery team. And you can see just the services from robotic surgery. We are a robotic center of excellence. And again, another accreditation. And we've got surgeons, master surgeons of excellence in urology, in colorectal, as well as I know that hepatobiliary, he is going for that. He has not yet. He's new. He just started last August, Dr. George Unin, and hasn't yet received his master surgeon yet. And then we do have plastic and reconstructive surgery as well. And they conduct breast surgery, lymphatic surgery, aesthetic surgery, as well as gender surgery. So, you know, again, we've got a tremendous team of doctors, early and mid-careerists. The fifth floor is the Women's Health Center. We got a lovely donation from Charlotte Benjamin. So we have named it the Charlotte Stump Benjamin Center for Women's Health. And with the understanding that better healthcare for women means better health for the community. I think all of you know, this is a statistic, a fun fact, 80% of all healthcare decisions are made by women. And so we really feel that we want to educate everybody, but just given that stat, women make decisions on behalf of their children, and then they usually, I can speak for myself, I often have to nudge my husband to go seek care. We offer pregnancy and childbirth, gynecology, breast health, urogynecology, maternal fetal medicine, genetic counseling, physical therapy and rehab, specifically for pelvic floor, on that floor. Again, bringing those pieces together. And Dr. Masigua, she just joined us. She's Urogyne. She went to Georgetown, and then she got a 3-year fellowship from UCLA in Urogyne. And I love this quote. This speaks volumes. Women are running businesses, being parents, taking care of their aging parents. We put ourselves last. The Center for Women's Health brings excellent physicians together in one location so that patients don't have to drive all over the region for care. As a doctor, being able to go down the hall to consult with a variety of women health specialists face to face and get back to my patient immediately is kind, thoughtful care. And I love that quote. That's Dr. Masigua on the right in the top picture. And she's just a great asset. She actually was a resident here. And when I asked her why she came back, she said, "You all were so kind to the residents. I didn't put them through the ringer." And that's why she came back, which I think speaks volumes after her 3-year tenure at UCLA. Again, just in closure, the Pavilion is modern, it's comfortable, it was thoughtfully designed, ample parking. Yes, it is $7. It is accessible by public transport. And really, we want to move beyond sick care and really give thought to health and wellness and then recovery as needed. So I'm going to stop there and ask if anybody has any specific questions.
We had a couple of questions about what practices are accepting Medicare patients. And the question was, is it up to the individual practices within the Pavilion, or is it generally, if you're on Medicare, you're good to go?
So again, it's my understanding the VHC Health Physician Group does contract with Medicare. if you see a practice that is not a VHC health practice, I would ask you to speak to them, or go to their website. Different practices have different principles, if you will, and operations requirements. So if you are seeing a VHC physician, we take Medicare. If you have a non-VHC health provider, please speak to them or go to their website to see what their operating principles are.
There's a lot of questions about geriatricians. If you go to the hospital's website, vhchealth.org, and you click Find a Doctor, you can click that Find a Doctor. There's a right on the top of the web, there's a Find a Doctor button, and then it'll say what specialty, and you'll see gerontology, and you can click that button, and it'll pull up all the doctors who are Jared. But no, not every doctor at the hospital is part of VHC health. All the ones in the Pavilion are, that's right, Robin? All the ones in the Pavilion are, but if they're located in the 1715 or the other one, then not all of them are VHC health physicians.
That is correct. In Pavilion, they're all VHC. In some of the older, the other medical office buildings, they are private practices that are on our campus.
Okay, next question is, how long generally does it take to get an appointment with a physician or practice in the Pavilion?
That's going to depend on the specialty and also on the issue that you may have. So we try to get patients in within 10 business days as much as possible, knowing that issues, often will resolve themselves again, for sick care. So we want to get the folks in quickly. So it depends on the issue. And again, if it's an emergency, we'll get you in. We do keep appointments same day, next day. There's a practice where, again, we want to make sure we can get folks in same day, next day. So it really depends on your availability as well. If you're available early morning or later in the afternoon, certainly that's always a good time for availability. So yeah. It really does, and I hate to say that, but it does depend on the practice.
And remember, it's not just at the Pavilion, right? So we have primary, as Robin said, I don't want to go in detail, but we have primary care practices, multiple in Arlington, McLean, Falls Church. So if it's specifically about primary care, then not as much. If you don't mind, we're gonna continue on, and then we'll continue to address questions at the end, just so we can get through everything. Because I do want to go back to the question that the person had about parking. So just to reintroduce myself, my name is Kathy Turner. I'm the Director of Senior Health and Health Promotion here at VHC. I'm also, like Cheryl, on the board of A&D. So they asked me just to do, so some of you may not be aware of this, but the Senior Health Department at Virginia Hospital Center is the only local provider of a medical alert system in Northern Virginia. So we service all of Northern Virginia. It is managed by our Senior Health Department. The medical alert is a program that provides 24-hour assistance at the push of a button. So something happens, especially for those of you who are living at home by yourself, something happens and you need help for whatever the reason is, you push your button, live person comes up over the machine and or your button, depending on what you have, and we will call a family member, friend, neighbor, or if necessary, 911. I think the beauty of our program, it's the senior health staff that actually is going out, doing the installs, doing the service calls. So we really develop a relationship with our subscribers to promote familiarity and build trust. There's no long-term contract, it's month to month. Senior associate members, senior associates, A&V members and senior associate members receive a discount. So if you're an A&V member, you do receive a discount on the Lifeline. All right, oops. We have different kinds, so we really work to people to find what's best for them. We have landline or cellular units. So for people, depending on if they have a landline anymore, we have a cellular. We have both the pendant and wrist options. We have a fall detection button. So that's if, let's say you fell and you couldn't push your button, the button detects a fall, and so it will send a signal. And then all our buttons are waterproof, so you can wear them in the shower. We're super excited about this because we now have a variety of mobile systems. So we have in-home units, and we really recommend those for the people who really don't go out and about that much. And if they are going out of the home, they're always with other people. But for some people who are more active and they're going for walks, they're walking the dog, they're out in the garden, they're traveling, the mobile buttons are really nice because they work anywhere in the US. They have the two-way communication right through the button. They have GPS tracking, and they have the built-in detection. Again, they can be used anywhere in the US. They come with the charger. They're waterproof. So we have on the right-hand side, you can see different options. And we really work with people if they want a mobile button to talk about the differences between all of them and what's going to work best. The thing that we're most excited about is last month, Lifeline came up with a new watch mobile, and we are liking this a lot because we have a lot of people that have told us, oh, well, maybe they have the Apple Watch has the fall detection, but they get so many false calls or it's so complicated to work. The medical alert watch through Lifeline was built just as a medical alert button, right? So it's very simple to use, but it does have the ability to track your steps and to track your heart rate. So again, it's just a really great option, and we're so excited that we now have that. And I think that it's really important if you have a medical alert device, it's a device that was designed specifically for medical alert and not as a side that was just added in. So we're excited about that. Just people should know about some other programs. We do have a program. We're really proud of this because the Lifeline program is run through Virginia Hospital Center. We do have a special program called Safe Transition, where any patient who is discharged from VHC can receive the Lifeline for 2 months at no cost. And the purpose of this is we know those first 2 months, people are most at risk for readmission. So we want our patients to leave the hospital with safety and peace of mind, not just peace of mind for them, but also for their family members. And it really does help to minimize readmissions and promote a continuum of care. Again, it's hands-on service from our senior health staff. And then people have the option to continue it after 60 days at a reduced rate. And I would say about 50% decide to keep it, 50% don't. The 50% that decide to keep it are probably the ones that said they should have had it before they arrived to the hospital. We have the ones that don't. We have a lot of our joint patients who are getting knee and hip replacement. And they really want to have that in place for their first couple months after surgery. And then after 2 months, they've recovered and they're still pretty healthy, so they don't need it anymore. But it's a great option. We also have
a question. I have a question about that. I've got a friend who was discharged from the hospital into a rehab facility who is getting ready to move potentially back home, can she qualify for that 2
Yes,
months?
if they got discharged from our hospital and they're going into rehab, we do honor that. Yes, so have her give us a call. Yep.
Okay, all right,
Yep.
thanks.
We also have a Lifeline Assistance Funds, which provides financial assistance for community members to receive the Lifeline service. We know there are a lot of at-risk seniors in our community who need Lifeline but can't afford it. So we have a very simple questionnaire that they fill out, and if they're eligible, it typically reduces the cost by anywhere from 40 to 60% per month, and we're proud of this one as well. We do have a lot of additional senior health programs. We coordinate the Walk Fit walking program. It's every Thursday from 8:30 to 9:30 at Lubber Run. It's a free program. We have a member of our senior health staff that is there. We do regular blood pressure screenings. We do birthday celebrations, lunches. So it's just a great way to connect, get some exercise, and of course, perfect for this time of year when it's 98 degrees out because you're able to walk inside. We also coordinate a dementia caregiver support every month, and this fall we'll be starting a congestive heart failure support group. We do a variety of senior fitness classes, both virtual and in person. So you can see here some of the ones. We do monthly healthy aging lectures on a variety of topics. What we really try and do is each quarter we have 2 healthy aging lectures that are virtual, and then we try to do one in-person event, whether it's a lecture or an event. So I think last quarter we did a nutrition lecture with some cooking demo. This quarter we're doing our housing fair. So as Cheryl mentioned, we're doing a housing fair on Friday at Lubber Run from 10 to 12. And what we wanted to do is we wanted to provide the folks in the community with the opportunity to learn about the different senior living options that are out there. You know, so many of us, we don't know what's the difference between independent care, assisted living, continuing care. So you have the opportunity to sit and talk to some of the different housing folks that are in our community, and talk to some of the ones that are, you know, lower income, mid-income. But for those of you who are still in your home, we also wanted to say, well, what are some things that you can do to remain independently in your home? So we've got that as well. So if you're interested, stop by anytime between 10 and noon at Lubber Run this Friday. We do all sorts of wellness fairs. We've worked with A&D. Some of you may have attended the wellness fair that we did, the health fair we did in May. It was done through a combination of support through Virginia Hospital Center, A&V, and Arlington County. We have a fall prevention fair that we're doing in September. That will also be at Lubber Run. And then someone asked about parking. We do have a program called Senior Associates. It's a membership program. There is a fee. However, if you come to the hospital a lot, it is a great thing. It's $65 for one person, $90 for a couple. And what you do is you get a card, and when you are a senior associate, I'm going to pull out the brochure right here so I can tell you all the benefits. You get 50, as in 50, complimentary parking passes. So I'll do the math really quick. If you come to the hospital 10 times a year, it pays for your membership. You get 10% off on the pharmacy for over-the-counter items. You get discount at the hospital food court. You get a 15% discount on our exercise classes. And then, so again, if anyone is interested, I can share, you can email me about any of the TVs. Oh gosh, I don't even know my my email. You can email me if you have questions, or if you want to get information, on that. So we offer, you know, one of our goals, right, of the hospital, and there's not a lot of hospitals that have senior health departments, departments that are dedicated just to programs offered for seniors. So we're really proud of the fact that VHC recognizes that as a need, and every year we expand the services that we are providing. Oh, someone asked, I see a question. Are mobile systems purchased and pay monthly? So the mobile buttons, the only mobile button that you buy is the watch. It's $99. All of the other mobile buttons, there's no purchase. You're just paying the monthly monitoring fee, which if you are an ANV member, the discounted rate is $47 a month, and it's month to month.
We had a question. Somebody wanted to know where on the VHC website can they go to read more about these life alert systems?
Yes, if you go to, I'll type it in, it's vhchealth.org/senior.
I have a question. I noticed on the main map when you first put it up that you had pulled out where oncology is, but I know that practice is leaving. Are you backfilling it with another oncology group?
No, because the VH at this point, my understanding is no. That oncology group is Virginia Cancer Specialists. So at this point, and Robin, you can correct me, VHC, we don't have VHC practice that is oncology. So my understanding for that is no. Yeah. I also wanted to mention in that map, and some of you may have seen that, it's still kind of confusing of where services are. People don't, you know, especially if you haven't been to the hospital a while. So if you go to one end of the hospital and you realize, oh, I was supposed to be at the other end, we have a little shuttle. It's almost like an oversized golf cart that will take you to the other side. And then when you have to go back to your car, that little shuttle will take you back to where your car is. So so that's kind of nice, and that happens on a regular basis.
Kathy, you mentioned about all of the senior health services. Are you located in the outpatient pavilion or in the hospital, or are you located somewhere else in the community?
I wish I was located at the hospital, but no, I'm at, good question now. Our offices are in Shirlington right now. Yeah.
Okay, so that's where if people want to be involved and get some of the services that you provide on site, that they would go to Shirlington.
Yeah, well, most of the services, we don't really provide any services on site. Most of our services we do, if they want to come pick up their senior associates card, they can come here, or we can send it in the mail. One of the services that we do offer here at the office, we do screenings twice a month. So we do finger stick, cholesterol screenings. We do CSP. We do blood, not bone density. We will be doing bone density again, but they're all screening. So blood pressure, body fat, resting metabolic rate. We do A1C, cholesterol, TSH. So if anyone is, they're wanting to maybe monitor some of their stuff in between their doctor's visits, they can come here and schedule a screening appointment. It's all out of pocket, but it's not expensive.
And you used to also do lectures for people. I think that was over on Carlin Springs Road.
Yeah, so now the Healthy Aging lectures are monthly. They're they're virtual. And then if we're doing it in person, we're either doing it at the Arlington County Library, the main library, or at Lover Run. So if we're doing an in-person lecture, like when we did our nutrition lecture, it was in person. I'll do a plug for myself. I'm doing an exercise lecture in September. And I'm going to be providing everyone who comes with free exercise bands. We're going to be talking about the importance of strength training for seniors. That's going to be in person in September. So I would say each quarter, 2 are virtual, 1's in person. If it's in person, it's at either Lover Run Senior Center or the Arlington County Library, because we did lose our space at
Right.
Carlton Springs.
Okay. Okay. Gary, any other questions in the chat?
Yeah, we've got one more. Do you do one-on-one nutrition and diet counseling, or helping people, figure out how to draw up healthier menus?
We don't in our office, but we do have outpatient nutrition services through the hospital.
Okay.
Okay.
And that is an area we're going to grow, because we do know that there is a need. So as the budget season is coming up, we're definitely looking at how we can continue to introduce healthy eating, really to address just some of the prevention that we've talked about today.
Okay.
Now, how would somebody make an appointment to take advantage of those services, the
I
ones
think
you were just talking about?
5811, but let me look. I'm looking up and seeing if I can see what that phone number is.
I'll see if I can get it online.
And by the way, I didn't mention this while Robin's looking it up. I've been at the hospital. It ages me if I say how long, but put it this way: when we changed to VHC Health, it was my 4th. I've been here through 4 name changes. So for those of you who lived in Arlington a long time, I've been here a while.
And you started when you were 10 years old, right, Kathy?
Yes, thank you, Cheryl. I started when I was 10.
Okay. Well,
I want to say it's 5811, but I don't know.
Yeah, I don't want to send you to the wrong one.
I don't either. If you email me, cturner@vhchealth.org, I'll provide it. I can give it to you.
okay. Well, Gary, any other questions, or will we?
No, I think that's about it.
Okay. Well, thank you, Robin Adams, Vice President of Business Development, and Kathy Turner, Director of Health Promotion and Senior Health with Virginia Hospital Center. This was very enlightening. And as I said, we've all seen the growth of Virginia Hospital Center, and now we know what's going on inside. So thank you so much for the presentation. So
Great. Thank you guys for having us. Good questions too.
okay.
Excellent. Thank
So
you.
next week, in case you want to know a little bit of a teaser, we're going to learn about the Pen Pals program, which is sponsored by Virginia Hospital Center. And it actually is a program that starts in September, of course, and it involves Arlington Neighborhood Village members as well as students in the Arlington Public School System. So you may want to listen to Noelle Durman, who is the coordinator. She's also a staff member with Arlington Neighborhood Village. So be sure and check that out, and you might want to get involved. So until that time, stay cool. It's going to be another hot day, and we'll see you next week at 10 o'clock.